Now we shall talk about the last and the innermost part of the external ear, which is the tympanic membrane. Fine. It is also known as the eardrum. So tympanic membrane is essentially a membrane covering which is dividing, or it forms a partition between the external ear and the middle ear. Fine. Talking about dimensions, it is round to oval in shape. It is about 9 to 10 mm in length, 8 to 9 mm in width. The thickness is about 0.1 mm. But coming towards the structure of the tympanic membrane, which is round oval, we can divide it into two parts. Fine. The pars tensa, or the tense part, and the pars flaccida. So the pars tensa forms the majority part of the tympanic membrane. Fine. So it is at the lower aspect of the tympanic membrane and the periphery. Let's create the structures first. This is the entire periphery of the tympanic membrane. So the periphery of the tympanic membrane is engrooved in a sulcus called the tympanic sulcus. And the periphery is thickened, called the annulus tympanicus. Fine. Then we have the posterior and the anterior malleolar folds. Why we are calling them the malleolar folds is because they are in relation with the manubrium, or the handle of the malleus. Malleus is the first ear ossicle. Fine. So this is the handle of malleolus, and these are the posterior malleolar fold, and this is the anterior malleolar fold, right? So the superior aspect is the pars flaccida, because it is flaccid, not very tense, whereas the inferior aspect is the pars tensa. Fine. Now the pars tensa can further be divided into four quadrants. You have the anterior superior, the anterior inferior, posterior inferior, and the posterior superior. Fine. The periphery, to note, is that the periphery is also a part of pars tensa. It is thickened to form the annulus tympanicus, which we already discussed. At the center, the tympanic membrane is tented inwards. So at the center, the tympanic membrane is tented inwards, and this point is known as the umbo. The umbo, so the tympanic membrane would look something like this, right? Now the umbo forms an angle of almost 55 degrees with the horizontal, and this is the reason why we get a phenomena known as the cone of light in the anterior inferior quadrant when we view the tympanic membrane through an otoscope, right? As the light is falling towards the tympanic membrane, because of this angle, because of the depression of the umbo, we get a cone of light at the anterior inferior quadrant. Fine. A point to note is that tympanic membrane is a very translucent membrane. So we will be able to see some structures of the middle ear. Firstly, in the anterior superior aspect, we'll be seeing a shadow of the eustachian tube opening. Fine. At the posterior inferior aspect, we will see the shadow of the round window. And the posterior superior aspect, we can see the incudostapedial joint. Again, we'll only see the shadow because it's translucent. Had it been transparent, we could have seen through it. But since it's translucent, we'll only see the shadow or faint margins of them. We will not be seeing the oval window because the oval window is in relation with the foot plate of the stapes, which we'll talk about later. So this is the general aspect of the tympanic membrane. Again, it's divided into two parts: pars tensa, which is the lower part, and pars flaccida, which is the upper part. Pars flaccida is also called the Sharpnell's membrane. Fine. Also, the tympanic membrane is slightly tilted at its lower aspect. So suppose this is the external auditory canal and this is the middle ear. So the tympanic membrane is somewhat tilted laterally. Fine. Now based on the tympanic membrane also we can divide the middle ear into three parts. That is the attic region or the epitympanum. The part which lies in parallel or in series with the tympanic membrane is called the mesotympanum. And below it we call it the hypotympanum. We'll talk more of these areas in middle ear. Fine. Last point to note about the tympanic membrane regarding its thickness, it is formed by three coats. You have an external covering of the skin or the mucous membrane which is lining the external auditory canal. Fine. We have the inner aspect which is again the mucosa which is lining the middle ear. And finally, we have a fibrous coat in the middle which is deficient superiorly. So these again are the general features of the tympanic membrane.